Welcome in. We are really thrilled to have you joining us today for this custom-tailored deep dive into the source material. We've compiled this analysis specifically for you.
Yeah, we have a really fascinating topic today.
We do. Today we're taking a magnifying glass to a highly specific and honestly kind of emerging question in women's health. The central question we're answering is this. Are polynucleotides effective for treating genitourinary syndrome of menopause, which is better known as GSM, as well as vulvovaginal atrophy?
It's a question that sits right at the bleeding edge of regenerative medicine right now. And to answer it, we have an incredibly robust stack of sources on the table.
Oh, really do.
We are going to be synthesizing data from multiple clinical trials, real-world case series, systematic reviews, and the absolute latest urological guidelines from heavy-hitting organizations like the AUA, SUFU, and NICE.
All right, so the mission here is to sort of cut through the medical jargon, distill the hard data, and find out if a biological approach, which happens to involve highly purified fish DNA, is actually the breakthrough, non-hormonal solution for what is undeniably a silent epidemic affecting millions of women.
Exactly.
Okay, so let's unpack this, because the best way to understand the scale of this issue is to look at the actual transition into menopause. When we think about aging or bodily changes, we usually expect like a gentle curve. But female hormones don't follow a curve.
No, they do not.
They drop off a cliff.
It is a profound and abrupt physiological shock. I mean, during a regular premenopausal cycle, estrogen levels can peak at around 800 picograms per milliliter.
Okay.
But as a woman enters menopause, those levels don't just dip, they plummet down to below 30.
Wow, from 800 down to 30.
Right. And while society talks endlessly about the hot flashes or, the mood fluctuations associated with that plunge, there is a massive structural collapse happening at the tissue level that rarely gets the urgency it deserves.
And that structural collapse is what leads to GSM. We're talking about severe vaginal dryness, intense burning, recurrent urinary tract infections, and just painfully difficult intercourse, which clinicians refer to as dyspareunia.
Yeah.
Our sources indicate that when that estrogen drops from 800 to 30, it triggers GSM in roughly 50 to 70% of postmenopausal women.
Which is a huge portion of the population.
It is, and honestly, reading through some of the newer literature, researchers suggest that if you actually look closely enough and ask the right questions, that number might be closer to 90%.
Which is staggering. Yet despite being so prevalent, GSM remains vastly underdiagnosed and undertreated. The literature shows us that upwards of 70% of women never even verbalize these symptoms to their healthcare providers.
Wait, 7% just don't say anything.
They simply suffer in silence. There is this pervasive, heartbreaking misconception that severe pain and discomfort are just, a normal, inevitable tax you have to pay for getting older.
It's so frustrating that so many people feel they just have to grit their teeth and bear it. And part of the reason they stay silent is because the medical field's traditional playbook hasn't really offered universally safe, effective solutions.
That's very true.
Let's look at what women are usually told to do first. The standard guidelines usually recommend starting with over-the-counter moisturizers and topical lubricants.
Right, and those can provide some superficial relief for mild, occasional friction, certainly. But to understand why they ultimately fail so many women, we have to look under the microscope at what GSM actually is.
Okay.
It's not just a surface-level moisture issue. The tissue itself is undergoing severe degradation. Estrogen is essentially the chemical signal that tells vaginal tissue to stay thick, stretchy, and well-hydrated.
And when that signal disappears.
Exactly. When it disappears, there's a massive loss of collagen, elastin, and naturally occurring hyaluronic acid in the mucosa.
So the tissue is literally changing.
The tissue literally becomes thinner, it flattens out, it becomes incredibly fragile, and it loses its robust blood supply.
So applying a standard over-the-counter lubricant to that environment is just providing temporary mechanical glide for a couple of hours.
Precisely. It does absolutely nothing to reverse the underlying cellular degradation. The cells are still dormant and starving.
It makes me think of like trying to revive a dying houseplant.
Oh, that's a good way to put it.
Yeah, if the soil is completely dead, dried out, and devoid of nutrients, you can spray water on the leaves all you want to make it look shiny for a day. But the roots are still failing. You haven't restored the ecosystem of the soil.
I like that analogy a lot. So when spraying water on the leaves doesn't work, clinicians typically move to the most effective medical treatment currently available, which is low-dose topical estrogen.
Right.
By applying estrogen directly to the vaginal tissue, you are finally giving those dormant cells the chemical signal they need to start functioning normally again.
And for many women, it is a game changer. It works beautifully.
It does. But there is a massive demographic of women who cannot or absolutely will not use estrogen in any form.
And we're primarily talking about breast cancer survivors.
We are. This is one of the cruelest catch-22s in all of women's health. Up to 70% of breast cancer survivors experience severe, debilitating GSM.
That's so high.
And this is often dramatically accelerated by the life-saving oncological treatments they undergo. Medications like aromatase inhibitors don't just lower estrogen. They are designed to systematically eradicate almost every trace of estrogen from the body.
Just to starve the cancer and prevent a recurrence.
Exactly.
But you have this huge population of women who have already fought through the physical and emotional hell of cancer, only to be rewarded with intense daily pain from GSM. And the one thing that could structurally fix it, estrogen, is the exact thing they are terrified of.
It's awful.
Even if a doctor explains that the systemic absorption from a topical cream is incredibly tiny, the psychological fear or the very real oncological risk of a cancer recurrence is just too high a price. It's an agonizing position to be put in.
It really is. And this exact therapeutic gap is what has driven researchers to look beyond traditional endocrinology. They had to turn toward regenerative medicine.
Okay.
They desperately needed to find a way to achieve biostimulation, to basically wake up those dying cells and rebuild the tissue without relying on estrogen to flip the switch.
Which naturally makes me wonder, if estrogen is out, what kind of biological workaround could possibly jumpstart that cellular machinery? The source material points to a completely different biological mechanism, polynucleotides, or PNs for short.
So let's establish what these are. Polynucleotides are natural origin, highly purified biological molecules. To be highly specific, they are fragments of DNA.
Okay.
And in the medical applications we are analyzing today, these DNA fragments are primarily extracted from the gonads, the sperm cells of salmon or trout.
Wait, time out. I have to push back on this for a second because as a listener, this sounds wild.
I know.
You go to a specialist for menopausal pain, and they prescribe highly purified fish sperm. I mean, that sounds completely bizarre, maybe even a little like snake oil. How is that biologically possible, and why fish?
I completely understand the skepticism. It sounds like science fiction. But the reason researchers use salmon and trout DNA is because it highly mirrors human DNA structure.
Oh, really?
Yeah, and it can be extracted and purified to such an extreme degree that no proteins or immune-triggering compounds are left behind. It's just the pure, raw biological code.
Okay, that makes more sense.
And what's fascinating here is how it interacts with human biology. Unlike hormones, which act as systemic whole-body messengers, polynucleotides work through localized cellular biorevitalization.
Okay, so what happens when you actually apply this purified DNA to the vaginal tissue?
When you apply PNs to the tissue, they don't just sit on the surface like a lubricant.
Yeah.
They are progressively cleaved, which means they are broken down by naturally occurring enzymes in your body. This cleavage creates a slow, sustained release of small nitrogen precursors, things like nucleosides, nucleotides, and nitrogen bases.
So the DNA is essentially being chopped up into the fundamental building blocks of life.
Yes. And as those fragments are released, they seek out and activate very specific receptors on the surface of your cells, specifically purinergic receptors and CD39 receptors.
I've seen those terms all over the clinical data we reviewed, but what actually are purinergic and CD39 receptors?
Yeah.
Why do they matter?
Think of these receptors as specialized keyholes on the outer membrane of your cells. Usually in a postmenopausal state, the cell just sits there idle, waiting for estrogen to tell it what to do.
Right.
But when these specific nitrogen fragments slot into the CD39 and purinergic keyholes, it unlocks a massive biological alarm clock. It physically wakes up the fibroblasts.
And fibroblasts are the cellular factories, right?
Exactly. They are responsible for manufacturing collagen, elastin, and hyaluronic acid. You are directly feeding the cells the exact raw materials they need to produce new structural proteins.
Let me make sure I'm wrapping my head around this. If we use a factory analogy,
Okay.
estrogen is usually the CEO of the company shouting over a megaphone to tell the workers to increase production. But when the CEO leaves during menopause, production halts.
Perfect.
What you're saying is polynucleotides don't replace the CEO. Instead, they're like dropping off a massive freight train of raw steel, concrete, and blueprints right at the factory door.
Yes.
The workers, the fibroblasts, see the materials, recognize the blueprints, and just get to work building the scaffolding themselves, completely bypassing the need for the CEO.
That is a brilliant way to conceptualize it. You are entirely bypassing the hormonal pathway and providing a direct, localized nutritional and mechanical stimulus.
That's incredible.
And as an added bonus, because of their unique molecular structure, these PNs naturally bind together to form a three-dimensional gel inside the tissue.
Oh, wow.
Yeah, this gel acts like a biological sponge. It deeply binds water to the tissue and provides intense structural hydration from the inside out.
Okay, so dropping off raw steel and hydrating from the inside out makes complete logical sense in a laboratory setting. But human bodies are notoriously stubborn, especially as we age. Do we actually have proof that these older, dormant cells will pick up those tools and use them?
We do.
Because as a listener, theories are nice, but you want to know if this holds up in the real world. Let's look at the clinical data.
The clinical data is where this truly shifts from a fascinating biological theory into a legitimate medical breakthrough. Our sources highlight studies covering three main delivery methods: vaginal ovules, topical creams, and intradermal injections.
Let's start with the ovules.
Right, so these are inserted vaginally. There was a dedicated cohort study of 54 postmenopausal women who used PN-based ovules daily for 2 to 4 weeks. To measure the results objectively, investigators used the Vaginal Health Index, or VHI.
And it's important to note that the VHI isn't just a survey asking, how are you feeling today? It is a rigorous clinical measurement evaluating elasticity, fluid secretions, pH levels, and epithelial integrity.
And the recorded improvements on the VHI were extraordinary. Across the board, vaginal hydration increased by nearly 60%.
Yeah.
Vaginal secretions went up by over 50%, and the deep tissue elasticity improved by over 50% as well.
Let's just pause on those numbers for a second. A 60% increase in tissue hydration for someone suffering from severe GSM isn't just a marginal statistical bump. That is a life-altering difference.
It really is.
That is the difference between daily, agonizing friction when you're just trying to walk around or sit at your desk and actually feeling comfortable in your own body again.
It's transformative. And just as importantly, the treatment actively restored the healthy acidic vaginal pH. It consistently brought it back below the crucial 4.6 threshold.
Why is that 4.6 threshold so vital? I know pH changes during menopause, but what's the actual biological mechanism there?
So when estrogen drops, the vaginal pH naturally becomes more alkaline, rising above 5.0 or 6.0. In an alkaline environment, the protective, good bacteria like lactobacilli die off. This leaves the door wide open for hostile bacteria to colonize the area, which is exactly why so many postmenopausal women suffer from agonizing, recurrent urinary tract infections.
Oh, that makes so much sense.
Right. By bringing the pH back below 4.6, the polynucleotides are making the environment acidic again, effectively locking the door against bad bacteria and allowing the protective microbiome to flourish.
That alone is a massive win. And the real-world data on the topical creams mirrors that success. We're looking at a case series evaluating PN creams, where over 60% of the women reported dramatic symptom relief within just 2 weeks of use.
2 weeks is incredibly fast.
And the specific metrics are astounding. Vaginal burning dropped by over 70%. Overall dryness dropped by over 70%. And dyspareunia, painful sex, dropped by 71%.
Just imagine the psychological and relational impact of that. We're talking about couples who may have avoided intimacy for years out of fear of pain, finally being able to reconnect.
Absolutely.
And for clinical cases that require even deeper, more intensive remodeling, specialists are turning to intradermal injections. These are often branded under names like nThe. These injections combine polynucleotides with hyaluronic acid.
So they're injecting the building blocks directly into the deeper layers of the mucosa.
Exactly. In a pilot study involving 50 women who received 4 sessions of these PN and HA injections, the investigators noted statistically significant clinical improvements across every single metric of mucosal health, with 0 reported complications.
0 complications.
None. And to bring this full circle back to our breast cancer survivors, a separate, rigorous 6-month study following 60 survivors conclusively proved that PNs are a highly effective, incredibly well-tolerated, entirely non-hormonal option for them.
I do want to push you on one thing here. When we look at these massive 70% drops in pain or the increases in elasticity, Are these treatments actually reversing the biological clock of the tissue, or are they just acting like a really, really high-tech, expensive internal moisturizer that masks the pain temporarily?
That is the pivotal question. If we connect this to the broader picture of histology, the microscopic cellular structure of tissues, the evidence shows they are definitively turning back the clock.
Really?
Yes. Polynucleotides are physically restructuring what clinicians call the comfort layer of the mucosa. They are reversing the thinning, they are fortifying the fragile blood vessels, they are densely rebuilding the extracellular matrix.
So it's not just a Band-Aid.
Not at all. You aren't just getting slip or artificial glide. You are quite literally generating a structurally younger, thicker, more resilient mucosal barrier.
Which raises an inevitable comparison, because anyone listening who is familiar with regenerative medicine or women's wellness has likely heard of other trendy therapies. The most common one being PRP, platelet-rich plasma, which is often heavily marketed in clinics as the O-shot.
Right, very popular right now.
If I'm a patient looking at my options, how does a standardized fish DNA treatment compare to a treatment where a doctor draws and spins my own blood?
It's a highly relevant comparison to make. Both PRP and polynucleotides are utilized to condition and regenerate that superficial comfort layer we've been discussing. However, the source material notes that currently there are no large-scale head-to-head vaginal trials directly comparing the two.
Okay.
But there is a fundamental biological difference in the raw material itself. PRP relies on the patient's own blood. This means the quality of the plasma, the actual concentration of growth factors, and the regenerative potential varies wildly from person to person.
Oh, I see.
It's heavily dependent on the patient's age, their baseline health, their diet, their stress levels.
So if your body is already systemically depleted, or say you are recovering from intense chemotherapy, your own blood plasma might not actually possess the robust biological building blocks you desperately need, whereas the polynucleotides are batch standardized.
Exactly. With KENs, every single dose, every single ovule or injection delivers the exact same clinically validated concentration of highly purified DNA fragments. It is a guaranteed delivery of materials, regardless of how exhausted the patient's own system might be.
Although I think it's crucial to clarify a boundary here so we don't overpromise, the guidelines and studies are very clear about what regenerative therapies cannot do.
Very true.
Neither PNs nor PRP are going to mechanically tighten the vagina in a muscular sense, nor are they going to fix deep pelvic organ prolapse. If the underlying muscle or fascia geometry is severely compromised, DNA fragments aren't going to pull it back together. They are strictly targeting mucosal health, tissue hydration, and elasticity.
That's a very important distinction to make. They heal the biological surface, not the structural anatomy of the pelvic floor muscles. However, speaking of structural integrity, polynucleotides are showing absolute groundbreaking promise in the surgical realm too.
Oh, right, the surgical applications.
Yeah, they aren't just being used for the slow decline of menopause. They are being deployed for acute post-surgical healing. A truly fascinating study in our sources looked at patients recovering from pelvic floor mesh surgery.
And for context, pelvic mesh surgeries are notorious in the medical community for having incredibly difficult, sometimes agonizing recoveries.
Okay.
The tissue often struggles to heal around the synthetic mesh, and sometimes the tissue breaks down entirely.
Right, which causes the mesh to erode and become exposed, which is a severe complication.
Precisely.
In this particular study, they gave a group of recovering patients something called PT ovules. This is a formulation that combines polynucleotides with a compound called terpenol.
Okay.
In the control group, the patients who didn't receive the ovules, the rate of surgical mesh exposure or erosion was 7.4%.
Which is fairly high.
But in the group using the PT ovules, that severe complication rate plummeted down to just 1%.
Wait, 1%? That is an unbelievable reduction in surgical failure. It means the PNs were accelerating the tissue regeneration so rapidly and so robustly that it essentially sealed the synthetic mesh safely into place before the tissue could break down.
Exactly.
But what about the terpenol in those ovules? I read in the data that it completely wiped out yeast infections, but what exactly is terpenol and how does it do that?
Terpenol is a highly potent, naturally derived antimicrobial compound. It's an active ingredient you often find in essential oils like tea tree oil. But for this medical application, it is isolated and synthesized for clinical purity.
Okay.
It works by physically breaching and disrupting the cellular walls of fungi and certain bacteria. And the results in this surgical study were remarkable. At the 1-month post-op mark, 21.5% of the control group had developed Candida albicans.
So severe yeast infections, which are common when the immune system is stressed after surgery.
Right. But in the group using the PT ovules, the infection rate was 0%.
Zero. It entirely eliminated the yeast infections. The terpenol breached the fungal walls, while the PNs rebuilt the human tissue.
Exactly. And this raises an incredibly important point about the ultimate goal of regenerative medicine. Polynucleotides are vividly demonstrating that regenerating a robust, healthy mucosal barrier is your absolute best frontline defense.
Defending against both mechanical and biological threats.
Yes. It defends against mechanical failures like mesh erosion, and it defends against biological threats like severe bacterial and fungal infections. When the tissue is no longer starving and has the nutritional support it needs, its natural biological defenses are incredibly formidable.
So to synthesize all of this for you listening, the hard data overwhelmingly points to yes. Polynucleotides are highly effective for treating genitourinary syndrome of menopause and vulvovaginal atrophy.
Without a doubt.
Whether delivered through daily ovules, topical creams, or targeted injections, they offer a rigorously researched, scientifically backed, entirely non-hormonal regenerative therapy. They restore critical moisture, they rebuild the elasticity, and they reset the natural pH balance. And they do this not by forcing the body's hand with synthetic hormones, but by simply feeding the cellular factories the exact DNA building blocks they need to construct their own repairs. It is a massive, paradigm-shifting win, especially for breast cancer survivors who have been marginalized by traditional treatments for way too long.
If we connect everything we've unpacked today to the bigger picture, the sources we reviewed really challenge a fundamental, almost philosophical assumption we have about human biology and aging.
How so?
Traditionally, the medical establishment, and really society at large, has viewed tissue degradation in menopause as a dark, inevitable destiny. We've been taught to view it as a hardwired, irreversible decline dictated entirely by the loss of estrogen. But the success of polynucleotides suggests something entirely radical.
Which is what?
What if a significant portion of age-related tissue atrophy isn't actually an irreversible decline? What if it is, in reality, a localized nutritional deficit?
Wow.
The clinical data shows us that by simply replenishing the local cellular environment with basic fundamental building blocks, these nitrogen bases and nucleotides, the human body proves it is still entirely capable of rebuilding itself, even in the complete absence of its primary hormonal director. It reframes the concept of aging.
It really does.
It shifts the narrative from a state of inevitable permanent decay into a highly reversible state of cellular starvation.
From an inevitable cliff you fall off to a reversible state of starvation. You don't need a new foundation. You just need to deliver the right material so the body can do what it knows how to do. That is an incredibly empowering lens to view our own biology through.
It's a very hopeful message.
It really is. Thank you so much for joining us on this deep dive into the source material. We hope this exploration leaves you feeling deeply informed, newly empowered, and fully equipped with the knowledge to advocate for your own health and comfort. We will see you next time.